Medical interns have rejected the government's deployment program, declaring that they will not report to their assigned internship stations until government addresses their concerns and reaches a consensus with them. Among their key demands is the withdrawal of the NETH policy 2026, which they say undermines the welfare, training and future of young health professionals.
You want us to come to us, we sit down, we understand what's in the contract. It's only reasonable. Before you enroll someone to something, you must give them a contract, like we see where we are heading, what we are signing up for. We are asking for too much? We are not asking for too much. This is only common sense. It's only the way things are done. That is why I'm saying, now that I think that question should be asked to the ministry and the stakeholders. When are you coming to discuss with these ladies and gentlemen so that they go to the sites?
The interns are also demanding allowances equivalent to 75% of the salaries earned by fully employed medical officers, arguing that they cannot effectively serve patients without adequate financial support. They say government deployed them to health facilities without first resolving the issues they had raised.
We are here because we have been raising our concerns to the Ministry of Health and Ministry of Education and Sports for 6 months now, and they have not replied to us at all. The problem is that they have inducted what they call the National Education and Training Policy, in brackets it's called the NETH policy, and we are not happy. This policy aims at scrapping off interns' allowances and extending medical school for another 6th year. So we are saying that we as interns, we deserve better. We deserve payment. We come from humble backgrounds. You cannot send us to the villages without any facilitation. How are we going to stay? Where are we going to stay? How are we going to dress?
The Ministry of Health okusasula bonna ba medical interns wetuna batatusasuddwa miliyoni nnya tetugenda kulinnya ku sites. Tuli serious, twetaaga sente, twetaaga okugula emmere, twetaaga transport, twetaaga okusasula rent. So Ministry of Health mutusasule ffenna ba medical interns.
Allow our interim president to access the Ministry of Health.
Addressing us, we have addressed all the interns.
Exactly. Yes, we're just part of the
Hundreds of interns later marched from Uganda National Referral Hospital to the Ministry of Health headquarters, carrying placards and chanting slogans demanding fairness, justice and improved welfare.
Hey, we want pay! We want pay! We want pay! We want pay!
Sawa mwagala ki? Abasawo mwagala ki? Muna Uganda! Muna Uganda!
If the two have gone, our police simply be around this way. But we have assurance of the safety. We don't want to be kidnapped. We don't want.
The Uganda Medical Association has thrown its support behind the interns, questioning how young doctors are expected to survive during internship without financial support. Professor Sima attributed the crisis to chronic underfunding of the health sector and called on government to urgently engage the interns and find a lasting solution.
Am I going to do pediatrics? Am I going to do internal medicine? Am I going to do surgery? Am I going to do obs-gyn? That's what professionals should worry about, not what am I going to eat? Where am I going to stay? How will I get there? Who am I going to borrow from? I've already borrowed enough for my tuition. Now who am I going to borrow from? Why are you causing uncertainty? Then you tell us about patriotism? Are you creating patriots here? Aren't you shooting yourselves in the foot? Are you even okay?
The association warned that failure to resolve the impasse could negatively affect healthcare service delivery across the country.
How possible is that when we don't have terms of deployment?
Yes.
Are we really hosted that the officials cannot meet us, give us audience, and we air out these issues before we will go for induction and then deployment? We are not resisting deployment, but we want to harmonize on our terms of operation.
Ask those people that they cannot even stand one day of a meeting without allowances. We have induction tomorrow. They are going to be facilitated the entire day in allowances. What makes them think we are going to go and slave around for a whole year?
The interns maintain that their protest is not only about financial remuneration, but also about safeguarding the dignity of the medical profession, improving training standards, and strengthening Uganda's healthcare system. The medical interns say they will only report to the internship stations after meaningful dialogue with government results in a mutually acceptable resolution to their concerns.
MP bw'abanga aweebwa miliyoni 360 yeevugemu awo ate nze ajjanjabu omuntu awone.
Communication. Yes. Stamp. Yes. Stamp. Yes. Secretary General. Yes. Secretary General. Yes.